Now, Medicare has two main parts that are the columns of the program and really the beginning of having healthcare when you are 65 years or older. That is Medicare Part A and Medicare Part B. And without one or really the other, you may not be getting all your bases covered. But what does the first half, Medicare Part A, actually cover? This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it'll keep you up to date about all the newest Medicare changes, Medicare options, and ways to make more better informed Medicare decisions. All right, here we go. So let's start off about the big picture of the two main parts of Medicare, Medicare Part A and Part B, because most of our clients, they are kind of confused about what some of those different parts do and what are their costs and where Part A ends and where Part B begin. Medicare, of course, is a federal program that provides health care for folks who are maybe no longer able to work via disability or because of old age, or hey, maybe they just are retired. But either way, the program helps share the costs that beneficiaries have. To be eligible, somebody just needs to be a U.S. citizen or a resident and lived in the United States for 5 years minimum contiguously. And pretty much that's it. Medicare has two main parts, Medicare Part A and Part B, and there's usually not a cost for the Medicare Part A portion because 98% of the folks on Medicare had paid into the Medicare system in one way or another during their working year. Part B does have a cost regardless of how much time somebody has worked or paid in the system. And in 2024, that is this year, that amount is $174.70 a month. And that number will actually generally go up most years, every year, annually. Medicare will usually start either when somebody is at the 65-year-old mark, or has been disabled for a certain amount of time, or if they have specific illnesses like ALS or end-stage renal disease. So that is the basics of Medicare, but let's talk about that first half of original Medicare, which is Medicare Part A. This coverage is specifically for covering things like hospitalization. That means that Medicare Part A comes into play as far as coverage when someone gets admitted into the hospital, usually because of something major like an accident or an illness. And like I said before, the vast majority of Americans who have Medicare Part A coverage, they're not going to pay a monthly premium on it. But there are costs like deductibles, daily pay rates, and limits to what are covered when somebody uses Medicare Part A. So let's dive a little bit deeper into that side of it as far as costs and deductibles, because Medicare Part A covers things in a very, very specific way. First, to utilize the coverage, someone must be admitted into the hospital. And again, that is a very, very formal process. That can be confusing if you just go to the emergency room or you get held overnight for observation. Those may actually not count as being admitted to the hospital. But to use Medicare Part A and to have the coverage, you have to be admitted to the hospital. Once this happens, then begins what is called a benefit period, which essentially is the beginning of the Medicare Part A timeline of coverage. Now, what I mean by this is that Medicare Part A has a deductible, and like you would have with maybe a car insurance or health insurance prior to Medicare, when the beneficiary is going to have an initial amount of money that they are responsible for prior to Medicare helping them out with those costs. For a car, that might be $500, it might be $1,000, or whatever it is per accident. But for Medicare Part A, it is $1,632 in 2024 for the first 60 days while somebody is admitted to the hospital. So from day 1 to day 60, that beneficiary is going to be responsible to pay the deductible, which if we average it out over the days, it comes out to actually a pretty reasonable amount of $27 per day if they stay exactly the 60 days. Also, let's stop here and talk about what is a benefit period, because that literally could mean anything at face value. But Medicare is going to count a benefit period as, quote, a benefit period begins the day you're admitted as an inpatient in a hospital or a skilled nursing facility. So that is when it begins, but it doesn't end exactly when you leave. The benefit period ends when you haven't gotten any inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. So if you sort of kind of bounce out and bounce back in, then you won't necessarily be restarting your benefit period each time, which we will see can sort of be a double-edged sword. Now, if we go back to the Medicare Part A coverage timeline, if someone stays in the hospital past the 60 days with the same benefit period, then that is when the daily cost will begin to apply. And keep in mind, what the cost is to stay in the hospital, it's literally bazillions of dollars, which means that these costs may look high through Medicare, and they are, but they are just a small fraction of what the cost it actually is to get that health care. So for the next pay range on the timeline, Medicare Part A will pay all but $408 worth of hospital costs per day. This means that if the costs daily are, let's say, $5,000, the beneficiary will only pay $408 that day. If the cost is $410, then the beneficiary, well, they are still going to pay the $408 that day, and so on. This will continue each day from day 61 through 90, which means that for the 3-month period or so, the potential cost for a hospital stay, if they stayed that exact 90 days, would be $12,240 in 2024, but that would also have to include the deductible of $1,632, so that brings the total to $13,872 if someone just has Medicare Part A coverage and no other supplements like a Medigap or Medicare Advantage or things like that. Once somebody gets to the end of that 90-day period is when the Medicare Part A limitations really start to kick in, because over that 90-day period, there is still a daily cost of $816 for each day after that, which is considerably larger than what they had paid before. But moreover, for each day past 90 days, it will count against somebody's lifetime reserve days. Now let's just take a moment to pause on this lifetime reserve days, because a person, they only get 60 days of this lifetime coverage for, like they say, their lifetime, which is, if you think about it, not that much. These lifetime reserve days start from the day 91 on in the benefit period, and once the 60 days are reached at that $816 for each of those days, once you get past that 60 days, then 100% of the cost for hospital services will not be covered by Medicare Part A anymore. So we can see here that obviously Medicare Part A is a powerful coverage that really can help somebody avoid major costs when they are in the hospital, but there are of course limitations and caps, because, well, healthcare is expensive and Medicare is not an inexhaustible program. And that aside, these limitations are the reason why Medicare beneficiaries oftentimes look for additional options like a Medicare Advantage plan or a Medigap plan or a Medicare supplement plan to help them pay for some of these costs that in the right situation could be absolutely astronomical. Now, that's going to be it for today for Michael's Medicare. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the information down below, or put it in the comments, or give us a call, or check out our other great videos on the socials, on the YouTube and Instagram. We got new content every week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.